Well, g'day everyone. Welcome back to Simon shoulder replacement. Day one post-op, but let's go into day of surgery. So I rock up to Hollywood Hospital at 12 o'clock, just before 12 o'clock, as I was instructed to do. I go into the check-in. They send me to where I'm meant to be for my check-in. Met with beautiful people, lovely staff there. If you're in Perth, you need to go for a private operation, and you've got your private health and your surgeon works there. Go to Hollywood. It's great. Food's great as well. So go there, go get taken. All my details get taken. Fill out the form. Find out that the operation's costing 14, just under 15 grand. It's just under 10 grand for the prosthetic itself. So it's pretty interesting. Then I get taken from the check-in area to a holding area where I've got my own little curtained off area where they do OBS, your first OBS, and a lovely African girl was doing that for me. My blood pressure was high. I told her straight out I've got white coat syndrome. If you don't know what white coat syndrome is, every time you put a blood pressure cuff. So again, every time you put a blood pressure cuff on your arm, your blood pressure just goes through the roof. Mine didn't go through the roof yesterday, but it was high. And she did it 3 more times, and it went down to normal. I had an ECG because I've had a heart issue before, which is called atrial fibrillation. I won't go into that. It's nothing bad. It can cause a stroke, but very rarely. So there I sat, listening to music, playing games, calling people, messaging people, watching YouTube. So I went pretty much through a whole battery of my phone during that time. Then after probably, I'd probably say 3.5 hours, I went to what I call a holding cell, which is just a tiny little room with, I think it had 4 little spots for stretchers or beds. And again, lovely nurses. Every time they come to give you medication or talk to you, they ask for your name, your date of birth, and then they check your MRN number, which was the registered number for your operation, or your patient number. Anyway, a lovely South African lady came in. She was the nurse or the doctor who puts me to sleep. She came in and she told me what was happening. She didn't exactly know what sort of drugs I was having, but she said, this is what's going to happen. This is where we're going to go. This is who your doctor that puts you to sleep is. She said the real name. I can't say it. And your surgeon is Dr. Travis Falconer, which I knew. So anyway, sat there for probably about another half an hour, had a conversation with a bloke across from me who unfortunately went in for a prostate biopsy and get something else done. So hopefully that turned out negative, because he was a lovely guy and he's been through a lot with his family and one of his sons. So hopefully that's all gone good for you. Then up on this display above the door of the holding area, my number came up. So I was number 3. So there was a 3 up the top of my ward little room thing, and there was a 3 on my bed. So that's the theatre. So that comes up, and probably about 5 minutes after that comes up, I've been taken in there, and my nerves started. Like, it was insane. They did another blood pressure check on me, and it was just after they gave me some medication, and I would have thought my blood pressure would have been huge, but it was pretty much perfect. So they gave me the relaxation drug, and then the next thing I knew, they were actually putting the oxygen mask on my face. And I was like, don't really want this on. They said, you're going to have to so you can go to sleep. So it's just 100% oxygen. And I kept on saying how good it was for hangovers. I think I said that was the last thing I said. Anyway, the next thing I know, I'm awake in my room. Or awake going into my room. And I was wasted. Like, I'm talking about seriously fucked up. Like a druggie. So it was insane. Like, I did that. If you might have seen it, the short I put on my channel. I said ta-ta. Mum was embarrassed because I was just being stupid like I always am when I'm coming out of these things. But yeah, it was great. It was really good. And again, the nurses were sensational. They really looked after me well. So anyway, Mum leaves about 8 o'clock. I've missed dinner. And unfortunately the food there is sensational. So I was really upset about that. Not that I probably would have eaten much, but they brought me in some dry ginger ale. I asked for a drink and they said, we've got lemonade, water, all sorts of stuff. And I said, I'll just have a dry ginger ale because it reminds me of bourbon. So dry ginger ale and ate some savoury biscuits. It was great. And I just asked for more biscuits and they came in. I asked for another ginger ale, they came in. Another more biscuits, they came in. One more ginger ale, they came in. But I ended up going to sleep at about 10:30. And every 5 to 10 minutes I was waking myself up snoring. I'm a stomach sleeper. And after this operation I need to sleep on my back. Because obviously you can't, fuck that hurt, you can't sleep with on your stomach when you've got your shoulder done. So I didn't sleep well last night. As you can see, my eyes were a bit swollen. I've been awake since probably 2:50 this morning. It's now 7:50 here in Perth. So that's 17 hours. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. 17 hours I've been awake. So hopefully I'll sleep well tonight. So yeah, anyway, they've been giving me these medication all night. I've got a number of medication that I have to take. It is osteo relief, got to take 6 tablets a day. Celecoxib, which is a anti-inflammatory, got to take 1 per day. Then I've got tapentadol, which is an opiate. I've got a slow release and a quick release or sustained release. The slow release is 100 milligrams and the quick release is 50 milligrams. So I've got to take those. The slow release, 2 tablets a day, 1 at 8 in the morning, 1 at 8 at night. And whenever I feel a bit of breakthrough pain, or the pain's getting closer, or the pain's getting stronger, more closer to the time I have to take the other tablets, not to be tough and just take that, the quick release tablet, just to calm that pain down. I said I wasn't going to do opiates, but that's all they could offer me. So unfortunately, there is no other option unless I want to go through insane pain, which I don't want to do. So what else I do today? Today I went and had an X-ray done, just to see if my shoulder was in the right place, and I'm happy to say it is. But all the actual components of the prosthetic haven't fallen away and they're all still there. Had blood tests for kidney function and hemoglobin. So apparently when you're on these drugs that they give you when you go to sleep, it can affect your kidney function and hemoglobin count. And also did a little bit of physio. So I'm not going to show you exactly what the physio was, but it did hurt. Actually, I will show you. So obviously with the other hand, you have to just make a fist on the side like that. So So you got to do, I'm doing 10 of these 3 times a day. Excuse me, another stand up. You've got to do supporting elbow, which I won't do now. Bicep curls, all the way down, all the way up, which we could just do 5 of those and not treat it as a bicep curl. And then I have to do bend over and supporting my elbow of the operated arm, do 5 pendulums one way and then 5 pendulums the other way, and see if I can get out further and further. So yeah, as you can see, you probably can't see it on this, but there's a hell of a lot of bruising. And you can see it. It's all the way down, all the way around. So there's a hell of a lot of bruising for what they did. Just got to keep an eye on that because it's quite tight and quite tender. So it could be turning into infection. I've got the waterproof dressing. So I don't know what they use, if they use staples or stitches. The incision is pretty much the most painful part for me at the moment. So I'm looking forward to getting this thing taken off to see the scar, because it's going to be pretty brutal, I think. But yeah, so day 1 post-op. Yeah, some of the time yesterday the pain scale was up to about 9 or 8. So now I've got no pain, just a little bit of an ache. That's because my tablets are starting to run out of its potency, so I'll take some more. What am I looking forward to tomorrow? Hopefully waking up after a good sleep. Got to do some work around the house with my mum. She'll do it all. I'm going to have to do that when she has her knee replaced. Going out for dinner tomorrow night over to my uncle and auntie's, and hopefully someone will cut up my food, because obviously I can't. Actually had for breakfast today, I had some Vegemite on toast, and I had to actually use my right arm to put the Vegemite on, because I just couldn't do it with my left. So, and I haven't been in the toilet yet, so I'm a bit concerned about when I have to wipe. Yeah, and that's all. Oh, I had to sign my name with my left hand, and I did all right with it actually. But when I edit this video and upload it, and I have to write the description, it's going to be hard typing with one hand, because I usually type with my right hand with a couple of 2 fingers in my left, but this time I'm going to have to do the whole thing with left-handed. Obviously can't drive, can't have any beer for at least 4 days. Once I get off the opiates, I might be able to have a beer. So 6 weeks in this lovely sling. It's really quite comfortable. I have a shower sling that they made up for me today. And yeah, and that's about it. So please like and subscribe to this channel, or like this video if you want, and subscribe to the channel, because now the real shit starts. This is when physio might start hurting. This is when pain's going to come through. This is when, you know, the post theatre depression might kick in. I'm feeling a bit down, but yeah, it's post depression or post theatre depression. It's an actual thing. Not as bad as I've had before, but it's definitely there. One of the painful things actually is taking off this sling, and then putting it back in, because you can actually feel where they've done stuff with the rotator cuff. So yeah, it's going to be good. Like, I'm going to actually get through this really well, with the support of family and you guys. I get a lot of really nice comments on this channel and my model channel, so I really do appreciate that. So if you watch this and you watch to this part, please give me a comment. It really means a lot, and it helps me push through this horrible time. Well, it's not really a horrible time, but it has been pushed through to when I'm going to be pain-free in my shoulder and I'll be able to play golf again. And surf and swim and go to the gym and do whatever the fuck I want. So, yeah, let me have a good sleep, and I will maybe, if there's any change in pain levels, I'll come back tomorrow and give you a bit of an update. But I might do this every 3 days, every 4 days, or probably every 3 days, just so you can see what's going on. Yeah, so you take care and have fun.